Hello and welcome to the Jefferson Society's Facebook page. My name is Ferky Ferrari and I am the president of the Jefferson Educational Society. As you probably have noticed, we're a few minutes late because we're trying to figure this thing out. A couple of days ago, we decided here at the Jefferson Society that all of our programming going forward, if at all possible, would be live streamed until it is recommended that we bring everybody back to the live audience. We miss you. We wish you were here. However, these extraordinary circumstances have made it a little bit of difficulty for our civic engagement programming. With that said, I received a phone call last week by LECOM's David Rubino, who is the Vice President of External Affairs, and he said, Ferky, are you doing anything on the COVID-19 situation? And to be honest, we were thinking about it, we just didn't have a plan of what to do about it. We at the Jefferson Society are about disseminating information based on research, and this brought an opportunity for us to do just that. So we partnered with LECOM for this particular program, and then we brought in a representative from the health department to help us shine some light in the situation. And with that, I would like to invite to the podium Monsignor Rubino from LECOM. Thank you.
Thank you, Ferky, and good evening, everyone, and thank you for joining us. LECOM is delighted to partner with the Jefferson Educational Society to bring you this question and answer forum on the COVID-19 virus. We think as an institution it's important not only to practice good medicine, but to share with our public ideas on how to practice good medicine, especially in this challenging time that all of us are facing. So tonight our program is very brief and very much to the point. We will have a representative from the Erie County Health Department speak to you about the virus, and then three of our physicians will briefly introduce themselves to you and then respond to hopefully some of your questions. This is the first time out of the box for a lot of us for this, so we're all learning as we go along, so we kind of beg your indulgence. But again, thank you for watching, and the representative from the Erie County Health Department is known to all of us. Rich Knecht retired, but because of the severity of this event, he was brought out of retirement to serve the health department. He'll be going through a few slides about the issues. Following Rich, three of our physicians will briefly introduce themselves. Monika Murillo, Dr. James Lin, and Dr. Danielle Hansen will present a bit about themselves and their background, and then the floor will be open for questions. So thanks again for joining with us. Thanks for the Jefferson Society for partnering with us. And Rick, the podium is yours.
Good evening, I'm Rich Knecht from the Health Department. I'm going to talk about COVID-19, and I've got 24 slides. Takes me 15-20 minutes, so prepare your drinks and your snacks during that time period. COVID-19, where do we get the name? Corona, virus, D is for disease, 19 is for the year. This is what a coronavirus looks like underneath the microscope. A coronavirus underneath the microscope looks very much like an influenza virus. They're both balls, but there's a difference. This is one kind of a virus, this is another kind of a virus. So they're alike, but they're different. These are the statistics from the last full year we had of the normal seasonal influenza here in the United States. Now, if I started showing you these figures about the pandemic that's going on right now, COVID-19, you'd be very worried. But we should be worried about the regular influenza. This is what happens to us every year. The vaccines are effective, but not always as effective as we'd like. And last year, or the year of 18-19, we had over 34,000 deaths. What's a coronavirus? Small spikes on their surface. You saw that picture. Coronaviruses infect mostly bats, pigs, and small animals. What exactly is a coronavirus? There are 7 coronaviruses. 4 of them we don't worry about. 3 of them we do. We've met them in SARS back in 2005, MERS, and this is the third one we're worried about, COVID-19. These viruses can mutate and jump to humans. That's what we're worried about. Like I said, the recent outbreaks have been SARS and MERS. What are the symptoms of the illness? Fever, cough, and this is a significant one, shortness of breath. Fever and cough, you see that in regular influenza. But with COVID-19, shortness of breath is an indicator that the physicians will look at when they're examining you. You may also see some of these other symptoms, fatigue, sore throat, headache, and nausea. From what we've seen so far, and remember, we don't have a lot of identified patients, COVID-19 patients here in the United States yet. Mostly they're mildly ill. Some are infected but without symptoms, and others have a mild illness that develops into a pneumonia. How deadly is it? This mortality rate is very flexible. This is dependent on the information we're getting from, I think, about 119 countries throughout the world. So this is going to change drastically. The more information we get from these countries, this number is going to slide either up or down, hopefully down. How many deaths do we see every year from just the regular seasonal flu? Less than, it's 0.1%. That's a small number, but a small number of, if you remember, over 32,000 deaths in the United States. Now, as testing increases, the rates may change. Who's most at risk? All ages have been affected. The risk of severe disease and death is highest in the elderly and those with debilitating health conditions. How at risk is someone in the U.S.? Right now, the current risk is low. We're seeing localized outbreaks, but we expect them to spread more rapidly. And if you've been following the news, you've seen how this is spread across the United States. It's spread very much like regular flu, respiratory droplets, sneezing, coughing, speaking. The droplets settle on nearby surfaces. They're ingested through the eyes, nose, and mouth. That's why we ask you to wash your hands religiously. You may not be around an airborne virus floating around in the air, but when the viruses are done floating in the air, they settle on a tabletop or on a surface somewhere. You then touch it with your hand, and you then touch your face near your eye, near your eyes, nose, or mouth. They did a study with college students, and I'm not quite sure how they did this, but in a 12-hour period, they asked a certain number of college students to record how many times they touched their face. They averaged 400 times in a 12-hour period that they touched their face. So if their hands touched something during the day and it was near a virus or picked up a virus, it probably got ingested into them. We also worry about close contact. It used to be 3 feet, now we're extending it out to 6 feet. If you're going to be in a group of any kind, try and stay at least 6 feet away from the individual. If they're coughing and sneezing, exit the area, don't stick around, get out of there. Viruses' survival on surfaces. Right now we're looking at 2 hours to 9 days. Depends on the type of surface, shorter times and warmer temperatures. We need to wipe down commonly touched surfaces frequently. You've heard about the cruise ships. What the schools are doing, they're wiping down everything that is commonly touched. And they're using disinfectant wipes and cleaners. How easily does it spread? We think it spreads about 1 virus person to 2.6 others. These are all numbers that we're not real satisfied with. Like I said, we haven't seen a lot of it here in the United States. We can't do a lot of our own epidemiological investigations. So some of these numbers are very variable. However, if we go with that 2.6 spread, that's higher than influenza, the regular seasonal flu. It's lower than SARS was, and it's far lower than the measles, which is very infectious. Again, these are all estimates and preliminary. Incubation period, right now from the information we have, we're looking at between 2 and 14 days after infection. That's according to the CDC. That may change, but that's what we're working with now. Average incubation period is about 5 days. That's the time from you're exposed to the virus till the time you start showing symptoms. Symptoms, cough, fever, and shortness of breath. Is there a test? You've probably seen this on the news. It's been out there quite a bit recently. Diagnostic tests are the only way to tell if it is the coronavirus or another infection. And you've heard about the new kits that are being developed and being spread, and hopefully we'll be able to start doing our own testing regionally and locally and can get a handle on how infected our community is. Face masks. Can face masks protect you? Surgical masks. This is a surgical mask, a face mask, painter's mask. A lot of people are getting these and wearing them. This won't protect you from somebody that has the virus. If they cough or sneeze in front of you, this is a barrier, but it's a pretty porous barrier. It fits loosely around your face, and there's lots of places where the virus can get in. It also doesn't keep particles out very well. You see a lot of people in China and some of the Eastern countries wearing face masks. A lot of that is because if you've ever been to China or watched the news about China, it's a very polluted country. A lot of coal dust in the air. So people are wearing masks just to protect themselves, not necessarily from the virus, but from particulate matter in the air. So a surgical mask may protect you, yes, if someone sneezes or coughs right in front of you, the droplets will land on here and you may not breathe them in or get them into your system. However, these masks become saturated from your own breathing, they get wet. Like I said, they become very porous. The answer to this is, does it really protect you? No, it doesn't, but it might protect you, only because if you're wearing this thing and you go to touch your face, you're gonna find out that you got a mask on and you can't touch your face. So it's a barrier, it's an inhibitor. What can we do to protect yourself? I don't know if you can read that. I wrote it a couple of times to make sure everybody saw it. It's wash your hands, please. Wash your hands as much as you can, or as much as is necessary. Particularly if you're out somewhere and soap and water are available, wash your hands. The best way to get rid of a virus is soap and water. Soap is a lubricant and it loosens up the dirt in your hands. It also loosens up viruses, and you wash them off, you rinse them off with water. Hand sanitizers were developed if you're not near a sink with soap and water. That you could use a hand sanitizer when you're out somewhere in public and you can't wash your hands at a sink. Down at the very bottom of the slide is a little statement, 2-week supply backup. This is what you can do also to protect yourself. You know, we always talk about if there's a tornado or a hurricane or a snowstorm and ice storm here in Erie County, that you should have a 2-week supply backup of items that you may need in your household. What we're talking about here is quarantine or isolation. If we tell you you need to be quarantined, you're going to be quarantined for 14 days or for 2 weeks. So you need a supply of things for approximately 2 weeks. You'll see runs on toilet paper, hand sanitizer, but also think about your medications. Do you have at least a 2-week supply of medications if you're quarantined? You know, I'm seeing bottled water being rushed off the shelves. We don't understand why people are buying bottled water. The water system's going to work. We expect it to work. The electrical system's going to be okay. We don't expect any major problems there. But a lot of people are buying bottled water. We think it's because they have these checklists about hurricanes and tornadoes and ice and snowstorms. Can you catch the virus from someone even before they have symptoms? We don't know that. We don't have the knowledge yet. We haven't found that out. It's an unknown. Can you get infected after you have already had the disease? Again, another unknown. We can't answer those questions yet. How concerned should you be? We all have a different level of concern. What may be a big concern to me may not be a big concern to you. But everybody needs to at least pay attention to the news, what's going on, listen to the information that's been putting out by the CDC. The CDC website, if you don't know it, is very simple, cdc.gov. You can also Google Erie County Department of Health, Pennsylvania Department of Health, lots of information out there. That's where you can find things that answers to many of your questions. So again, you need to be concerned. Right now, the anxiety level is high. You realize in the last 24 hours, we've been told that there's no international travel. They've canceled all sporting events across the nation. We're canceling events of all kinds across the nation, and we're closing schools. So within 24 hours, we've been hit with these 4 things, and it has increased the anxiety level to a very high level. Where did the coronavirus come from? It came from Wuhan, China. When did it start? December of 2019. I've got down bats there with a question mark. We don't know which animal it came from, but bats was one of the things on the list, so that's why I put it on there. But when you look at the map, Wuhan, China, right over here, in 3 months, it has gone worldwide. That's a rapid spread for a disease of any kind. So we're very worried about the rapid onset of this disease across the world. Distancing versus non-distancing. Social distancing is something you're going to hear a lot about. We in public health are really going to be pushing that in the next couple of days and weeks. And I believe one of the physicians from LECOM will talk a little bit about 1918. But if you look at the graph, the peaked graph is Philadelphia. Philadelphia had over 12,000 deaths over a very short period of time. The bottom graph is what happened in St. Louis. St. Louis went into full lockdown. St. Louis did massive social distancing, shut down churches, shut down schools, shut down bars, saloons, etc., etc. They kept everyone off the street, and they enforced that. And you can see what happened to St. Louis on their death rate. The period was a lot longer than it was for Philadelphia, but the amount of the mortality rate was significantly lower. And the one thing about 1918 is it's called the Spanish flu. It didn't originate in Spanish, and I don't think we even know where it originated, but there was a media blackout on the flu in 1918 because it was worldwide. Spain was the only country that was allowing reporters to publish about the flu that was going worldwide, so they called it the Spanish flu. How did it get to the United States? Guess what else was going on in 1918? World War I. We had troops of soldiers coming back, thousands and thousands of soldiers, many of them infected. And that's one of the reasons it got spread in the United States. Isolation, quarantine, 2 terms you're going to hear. If you're sick, we're going to isolate you. If you're under quarantine, that means you've been exposed to somebody. You're not necessarily sick, but we're going to quarantine you for 2 weeks. Now, this is a self-quarantine. We're not going to send out the sheriff's department or the police. Make sure you're staying home. But quarantine means that we want you to stay away from everybody for 2 weeks. If you don't exhibit any symptoms during that 2-week period, you're free to go. Isolation is a totally different animal. That means you're already sick, and we're going to isolate you. Maybe at home, it may be in the hospital, maybe someplace else. Travel, you've all read about and heard about travel. You need to, especially now, not do any international travel if you can avoid it. You know about the international travel shutdown that the president just recently announced. So that's going to go into effect, I believe, at midnight tonight. Drugs and vaccines. Okay, COVID-19 is a virus, the flu is a virus. Don't we have drugs and vaccines? No. They're alike, but they're different. So the vaccine that works for the seasonal flu virus doesn't work for COVID-19. And the antivirals that work in seasonal influenza don't work for COVID-19. The physicians can discuss this, but basically we're going to just treat it symptomatically. Again, my finishing slide, wash your hands. If you take nothing else away from this lecture, please wash your hands. Thank you.
Good evening. My name is Dr. James Lin. I'm president of LECOM Institute for Successful Aging. I'm a board-certified internal medicine specialist as well as a geriatric specialist. And I'm happy to be here to answer any questions and to talk about anything that relates to seniors in regards to this virus. Thank you.
Good evening. I'm Dr. Danielle Hansen. I'm also a board-certified internal medicine specialist as well as a geriatric medicine specialist. I am the Vice President of Acute Care, Behavioral Health, and Quality for LECOM Health, and I am available to answer any kinds of general questions or questions about when to see the doctor, those kinds of things.
Good evening. I am Monika Murillo, Infectious Diseases Specialist as well as Internal Medicine Specialist. I am here to answer any questions about COVID-19 today.
Great. So one of the questions that we do have coming in, and if one of you would not mind repeating it through the microphone, since I don't have one here, just simply put, seniors, why are we at greater risk?
So the question is, and Dr. Lin's probably the best to answer it, is seniors, why are we at greater risk?
Okay, so there's a few things. It's multifactorial. Number one, naturally, as we age, our organ systems become less able to compensate. So when your organ system is under attack, in this particular case, our respiratory system is under attack, as you age, your natural body's ability to heal or to fight off infection is decreased. In addition to that, second issue, most individuals over the age of 65 would have chronic conditions such as high blood pressure, diabetes, and other comorbidities. And when you add those comorbidities on top of the aging physiology, once the virus gets in your system, you're less likely to fight off the infection, and secondary infection can occur after that. That's why there's a higher mortality rate. Thanks.
Conversely, we often hear that we should worry about infants or children being susceptible to diseases. Is this the case with the coronavirus and COVID-19? Infants, children, are they at greater risk?
All right, the next question, to repeat it for those of you that may not have been able to hear, the next question that came in is generally when there's an outbreak of any sort of infectious disease, children and infants, similarly to older adults, are at greater risk, and is that the case with COVID-19? And Dr. Murillo is going to take that question.
So the data we have as of now from CDC, Chinese CDC, demonstrated over 74,000 patients, less than 2% were in children or kids below age 19. And there hasn't been reported deaths from that population so far, neither from Japan or South Korea. So far what we have based on that data is there is not much involvement on children.
We talked about washing hands. Any particular type of soap or thing I should be looking for when I get my soap and when I stock up for 2 weeks?
So the next question is asking about washing hands and if there's any specific type of soap or product to look for when shopping for supplies as people are shopping to stock up for the next 2 weeks.
No specific soap is necessary. Alcohol, however, it has to be more than 60%. It's outside.
So in hand sanitizer, the alcohol concentration has to be at least 60% for it to be effective. And you would look for that in your cleaning products too, household cleaning products, not just hand washing. And Rick wants to add to that.
From a Department of Health standpoint, we want you to wash your hands for 20 seconds. Count to 10, do it again. And when you wash your hands, wash them thoroughly, not just one side. Go around the fingers, back, the front, and rub them vigorously. But again, 20 seconds, 1 to 10, count to, or do it again.
Don't forget the thumbs.
So another question is, and this is centered around the when, not if. Do you think cases are present in Erie County? If not, when do you think we'll see some based on the spread of the virus so far?
So this next question is asking if there are any current cases reported in Erie County and when we would potentially anticipate seeing any in Erie County.
No, we don't have any documented cases of COVID-19 in Erie County. I believe the physicians have probably seen a patient or two or more that think they may have COVID-19, but it may have turned out to be the flu. Some of the symptoms, as I pointed out in the slides, are very similar. When will we find a case? We're not doing much testing right now. However, both Hammett and St. Vincent's are gearing up to be able to do testing in their labs here locally. Also, the two large laboratory corporations in the United States, Quest and LabCorp, are, I believe, now ready to do testing, although not here in Northwest Pennsylvania. They're just starting out in some of their larger centers across the United States. But we hope to have testing kits available here in Erie County very shortly, and we'll hopefully not get any positive COVID results back, but I can almost guarantee we're going to see some positive results here in Erie, Pennsylvania eventually.
When should you see a doctor?
The next question is, when should you see a doctor? I'll take that one, at least initially. And that's a very good question, because we want patients who have symptoms to get care, but we also don't want to expose anyone else in the doctor's office, including the care providers or anyone else in the waiting room or who's seeing the doctor for that day. We wouldn't want to expose them to the coronavirus if that's truly what someone had. So the recommendation really is to call ahead to your primary care provider, discuss the symptoms that you're experiencing, and then that primary care provider would determine whether or not you should be seen in the office or potentially at a different location. Now, of course, if somebody is severely ill, then they should just report immediately to the emergency room and not wait to speak with their primary care provider.
If we are in quarantine, how do we convince insurance companies to allow us to purchase our medicine before our refill date?
So the next question is, if we are under quarantine, how do we encourage our insurance companies to allow us to purchase our medications before our refill date?
I don't work for insurance companies. I'm not sure how I can answer that, but I can at least give some strategies, right? So in 2020, we have the advent of telephone, smartphones, and video conferencing. So one of the ways is that if you have symptoms, you should talk to your doctors, and if you're under quarantine, telehealth is a viable option. And with the advent of technology, again, most physicians will be able to send prescription medications to pharmacies, etc. When your prescription is due, a lot of the pharmacy here locally also delivers. So if you're under quarantine, there's strategies that you can get the medicines to you. So I think that under this type of condition, even if you're under quarantine, there should be methods and ways to get your medications on time, so you don't necessarily have to stockpile, but 14 days ahead I think would be reasonable. The next thing I would add is that under these kind of circumstances where nationally and statewide, etc., I think a lot of the insurance company will follow suit the CMS guidelines and stuff, and as soon as the CMS guideline feels that that's appropriate, I'm sure a lot of the insurance companies are going to follow suit.
The doctor mentioned technology. How often and how should we be cleaning our smart devices? Phones, laptops, tablets, how do we go about that?
So the question is, how often should we be cleaning our cell phones, our tablets, our laptops, or other forms of technology or handheld devices that we use frequently?
I can give you my opinion. I think every time you touch it, just like hand washing, if you have a hand sanitizer and or any antiseptic wipes, you should wipe it down. But the best advice is don't touch your phone unless you really need it. Some people just hang on to the phone and hold to their hands all the time, and that's probably not necessary. So,
and I think Rick wants to add to that.
Yeah, we've talked about this quite a bit at the health department. We're recommending, at least for smartphones, every 2 days, only because we sat around the tables when we're having conferences and meetings, like my cell phone, it's sitting on a table here. I have no idea what was here before. It needs to be disinfected. You also have to worry about the smartphone itself. They're not developed to have be sprayed with some kind of disinfectant spray. It may ruin your phone. Recommendation we got from the companies is take a disinfectant wipe, let it dry out a little bit so that it's not soaking wet, and then wipe down your cell phone. But also remember to take the cover off the cell phone and do inside the cover in the back of the phone. So we don't have any guidance from the CDC or anything on this. We're just going by the seat of our pants on this, but about every 2 days, and your laptop the same way, your computer the same way. Once again, when we're talking about you picking up the virus on your hands, or you're then putting your hands on your keys on the keyboard on the computer, and that's where the virus is going to sit till the next time you sit down. And I can guarantee that sometime while you're on the computer, you're going to touch your face. And if there's a virus in your laptop, you're going to ingest it in some one way or another.
What would you do if a husband and wife lives with a high-risk person, his mother for instance, and the wife works in a hospital and the husband is the risk person's caregiver? How do we go about keeping her safe?
That one's a little hard to repeat, so hopefully I catch all of the elements. The question is, what would we do if there's a husband and wife who live in a home where there's a high risk, another individual in the house who's a high risk or a highly vulnerable, which in this instance is the husband's mother. The wife, in the case, works in a hospital, so she's a healthcare provider that might have some increased exposure, and the husband is the elderly lady's primary caregiver. So what is the recommendation in that circumstance?
I think in that case, recommendation is like everyone's recommendation, prevent the spread. And how we prevent the spread is washing our hands, cleaning surfaces. If the person gets sick, obviously letting the health department and healthcare provider know, and all the household utensils and things have to be personal if they get infected for that specific person, to prevent the spread in the household to the other family members.
Why doesn't the U.S. government conduct screening to international travelers at the airport?
So the next question is, why doesn't the United States government conduct screening for international travelers at the airport? We're giving that to Rick.
There is some screening involved. I don't know if you've been in airports recently or when ships disembark, they're wiping thermometers across people's foreheads. I don't know how they figure out which flights or which ships they have to do this on, but I have seen workers in the airports taking temperatures on people. I don't have a good answer for that. I'm sorry.
Okay. Another question coming in from Facebook, a little bit longer, so Danielle, thank you. Are hospitals prepared for healthier patients to visit the emergency room? The ER has dozens of patients in waiting rooms that are often ill, but not with the coronavirus. Often you sit there an hour to 2 hours before being seen or tested. Are there provisions separately for those thought to have been infected versus those not?
And I'm going to try and summarize that. Essentially, the question is, are the hospitals prepared to continue providing care for those who are coming to the ER for services that are not potential coronavirus cases or other infectious diseases that may be contagious in a similar fashion? And I can speak to that, at least on behalf of Millcreek Community Hospital. Our emergency department does have a separate process in place to screen and spatially separate or separate those patients who may have airborne infectious diseases. We're also providing masks for them, as the CDC is recommending. Also, everyone, I think, is focused on rapid throughput for all patients in the ER so that less time is spent in the waiting room, less time is spent inside the ER, and everybody's needs are attended to more rapidly regardless of the reason they're there. We're going to continue to see several patients throughout the region and throughout the United States that have other problems that aren't related to coronavirus, influenza, or any other infectious disease.
Thank you. So, and also we're hearing from Facebook. They can hear me. So Danielle, you're off the hook. Next question is, do we have enough test kits in Erie? Do we have any test kits in Erie? And do we have the information in other languages for ESL residents here, such as Nepalese, Somalia, Swahili, Russian, Arabic, etc.?
Yes. Yes, we have translations for, there are 6 languages that we at the health department have developed and are developing 2 more, I believe, for all of the basic COVID-19 questions. Pretty much what I had on my slide, just to let these populations know what they need to be aware of. The second part of that, as far as test kits, there are no test kits in Erie County.
Can we expect when we might see test kits arrive here? And just for clarification, Rich, from you, where are or any of the doctors that might know, where are the closest test kits? So if someone is positive here in Erie or thinks they might be positive here in Erie, where are they going to get tested? How is that happening?
Testing is being done here. The actual lab that perform the results is right now the health department over in Exxon in Pennsylvania, and we have the commercial lab, LabQuest, opening a place to run the test. So we have to take the sample here and deliver it to them.
What is the current foreseeable cycle of COVID-19? For instance, at what point will we no longer consider it as it will tame or no longer, or it will be tamer this year and running its course? Just talk about the cycle for a little bit.
We don't know. As of now, as is a novel virus, we really don't know how long it's gonna last. We are hoping the weather and the humidity will help with clearance, and as it happened with SARS in 2002, but we don't have that answer now. It's unknown.
Let me add a little bit to that. We've heard about temperature and humidity and environment, and all we know is it's pandemic, it's global, and it's surviving in warm countries in South America and Australia. We call the flu an epidemic. Epidemic because it's only in certain parts of the world at any one time. When we're having our flu season here in the United States, as we are now, it is not the flu season in the Southern Hemisphere. When they're having their flu season, their winter in their flu season, it's summer up here, and we don't normally see seasonal influenza. But a pandemic is worldwide, everybody in the world is getting sick at the same time. What was the rest of that question?
Which one was it? Sorry, I was compiling other ones here. The cycle, that was the cycle question. At what point might we consider it to be tame this year or run its course?
Okay, I wanted to talk about tame this year. In the Spanish flu of 1918, it went through 2 cycles. We thought it was over, I believe it was in the spring of 1919, but then it resurfaced later that summer into the fall of 1919. And that's what we're worried about, is that we have a virus that doesn't act like we expect a normal flu virus to act like. And that was why the 1918 Spanish flu was such a threat to the world at the time. It went through 2 cycles.
For schools, what recommendations do you have for parents now spending the next 2 weeks with their children at home? Based on today's announcement from Pennsylvania Governor Tom Wolf, and then still with schools, college students heading away from campus, what recommendations there?
We can't control that. We can control the medical aspects of this disease. The sociological aspects we have no control of. We really don't have any recommendations. Many of us are parents ourselves, and running into the same conflicts that everybody else is having. But as far as students either in K through 12 or in the universities, we can't give you any recommendations on that. That's within your bailiwick, not ours. But the thing we are worried about is everybody is putting things off for 2 weeks. Well, at the end of 2 weeks, what's going to happen? Are we just going to open up the schools and let everybody wander back in? How are we going to judge whether it's safe for all of these kids, both elementary and university level, to come back to school and start their education again?
I think I'm going to add to that a little bit. So personally, I have had experience in SARS. I lived through that period when it was happening in Taiwan in 2003. My father was in the hospital and I was a caregiver, so I saw how that disease rapidly spread across the country in Taiwan back in 2003. In 2019 and 20, ABC News came out with a news article just about half an hour ago. It's online, abc.go.com or something. There is an article about Taiwan. Taiwan is a little island off the coast of China, near the hot zone. They have a 23 million population on that island. Currently, they only have 40-some cases on that island. They have one death. They have very few deaths, the reason why they're able to contain that so fast because there's lesson learned from SARS. So there's a few things that they did, and I can speak to this because my family still lives there right now, and they have shared with me, what lives is like in the last 2 or 3 months. So in the very beginning of the outbreak in January, they had a rapid deployment of what we're currently doing, where there was a command center set up and where they disseminate information very quickly, and they immediately educate the public on hand washing, making all hand sanitizer available in public places. And they did, it was during spring break or winter break during winter break, during that time in the outbreak. So for schools, they actually did extend the winter break for about a week or two. It's really a common sense approach, and Rick touched on this a little bit, speaking of masks. Culturally speaking, in Taiwan, people are just courteous in wearing masks in public because it's a barrier. And during this whole time, really the entire island, the residents there, they sort of all follow the same rules where if you're going out in public, they all wear masks. But again, as Rick mentioned, that's just a barrier. But really, it's about hand washing and having common sense approach. So not having a large gathering, not having all these things. So the school is open now, and what they require the school in Taiwan is that all the school kids and teachers, whoever's entering the school, they all have to wear masks. And the government actually took over the production of masks because there's a shortage in masks during that time. And now there isn't a shortage of masks because everybody just sort of follows the rules and there's plenty of supply. So I guess the lesson I'm trying to tell the public is that no one can predict when this virus is going to end, as Dr. Murillo and Rick said from Department of Health. We all have to just take common sense approach. We have to think of the greater good. If you're sick, don't lie, stay home, don't travel, right? If you've been to a hot zone, you really need to be honest with yourself and just self-quarantine for 14 days if you've been exposed to it. And really, you have to relook at your personal sort of activities and what's necessary, what's not necessary. And as a nation or as a community, we all have to make sacrifices. In the face of these type of diseases and stuff, you just have to make personal decisions not to travel if it's non-essential. You have to be courteous and not be selfish and thinking you need to hoard 50,000 masks, right? So we all have to take a common sense approach. And I think if we do that with the weather and with sort of what we're doing currently, both locally and nationally, that we're restricting travel, which is a good thing, I think this will come to a conclusion hopefully shortly. But again, no one has the answers, but the answer is if you're looking for answers, I think you should look in with yourself and just use common sense approach, and that's how you're going to beat the virus.
Dr. Lin, what measures are you taking to keep LECOM senior centers safe? In Washington State, most deaths have happened at senior centers. What are we doing here locally?
I'm so happy somebody asked that question. A week ago, when I was knowing that this is coming, we had our internal meeting. What we're doing, we instituted no visitors policy earlier than anybody else in the community. We're the first facility to do that. I was heavily criticized early on, but as you can see, a week later, now this is a national recommendation and there's a ban in nursing home visitation nationally, right? So what we're doing is we have no visitors unless individual is on hospice. That's our policy, and we're limited to 1 visitors at a time. And because, as I mentioned, my personal experience, I've been in the hospital with my father during the SARS season. I've seen what they did in the hospital. So the first thing I did was to limit all entrances and exit. There's only 1 entrance and exit. Every entrance and exit has a station with hand sanitizers and a station to take temperatures. And we actually ordered 4 thermal body cameras in our entrances and exits, so as everybody comes in and out, we have a thermal camera to limit the number of contacts that we have, and we measure the body temperature. We log everything, so we get the person's personal information, and we do the CDC recommended travel screening questions and risk exposure questions, and we take their temperature, and we keep a log of every person who comes in and out of the facility. And in the facilities, not just the visitors, we also have employees and vendors that deliver traffic. You know, there's traffic from employees as well as visitors. So we have imposed some restrictions in terms of employees being able to order from the outside food or inside, because most of our facility, we have the ability to provide food during the shift that they have. And then with vendors, again, we limit them to 1 entrance and exit, and we screen every vendor that comes in with all those questions, and we body temp them. Anybody who enters and exit need to redo this process again in our facilities. So some people criticize that's overkill, but again, I have a responsibility of taking care of the most vulnerable, and I hope that the coronavirus never enters in any of my facilities.
Concern for the near future resources. Do we as a country have enough beds, respirators, masks, healthcare workers? And this person goes on to note CBS just reported that 38 million will need healthcare and 9.6 million will need hospital care. Haven't had a chance to check that to see if that's factual, but just are we ready, and do we have the resources ready? Beds, respirators, masks, healthcare workers.
There's no way we could ever have projected the numbers that we may see if this pandemic gets out of hand. We just can't prepare for having enough beds, enough respirators, enough healthcare personnel to take care of all these people. We're going to do the best we can, but there's no way that preparing for a pandemic of the nature of, say, the 1918 Spanish flu, there's no way that we could have ever have envisioned that it was going to be that the numbers were going to be as high as they were. With this pandemic, yeah, we may have some high numbers, but again, we just can't have a hospital sitting idle with all kinds of medical equipment across the nation and healthcare workers on standby, waiting every 5, 10, 15 years for a pandemic to show up. So what I can say from a public health standpoint, we'll do the best we can with what we've got.
So final question before I turn it back to Monsignor Rubino for parting words. If there's one big takeaway, aside from what's on the screen, wash our hands, what does each one of you recommend to any of the viewers tonight or folks who will watch this later? Key places to get information, key information to remember. What are the big takeaways?
I'll start. So again, the big takeaway that I would give the audience or the viewers is that we all have a responsibility. We have to use a common sense approach, and we shouldn't go out and hoard stuff if there's no need to. And we just have to put this in perspective, right? Even though this is a new virus, this is a pandemic across the world. But if you look at the statistics and you put it in perspective, just the seasonal influenza so far, CDC for this year has said that there's somewhere between 36 million illnesses, and there's already 56,000 deaths for this season on the CDC website, the latest number I checked this season. So there are a lot of people dying from the flu as well. So if you take the approach that everybody has the flu, everybody has sort of presumed respiratory illnesses, and you take the universal precautions that we're recommending with hand washing and keeping social distances and so forth, I think that's a common sense approach, and I think everybody needs to keep that in mind and just put it in perspective. We have to be vigilant, but we can't panic, and we can't sort of go out and act like this is the end of the world. So that's my message.
All right. To piggyback on that, I was going to say we should plan, we should be prepared, but we shouldn't panic. We should be cautious with what we're using for resources or reference tools to gain information. So we want to use reliable sources of information, including the Pennsylvania Department of Health's website, the local Department of Health's website, as well as the CDC. We may want to limit some of our looking at social media or even some media coverage of things, especially for folks who have a difficult time with the increased stress that this may cause. But essentially, we really want to be prepared, be sensible, but don't panic.
Yeah, I would say don't panic, clean surfaces, wash your hands, and this is an ongoing pandemic. It's going to get worse before it gets better, so panicking, it won't help. So reading from good resources, keeping informed, and we are going to get through this.
You're going to see a large, rapid rise in number of infected patients with COVID-19. That's going to be because all of a sudden we now have testing kits. We're going to have a lot more tests done than we have now. We're only doing, I don't know, maybe 100 or more tests nationwide a day right now. We're going to be doing anywhere from 10 to 15,000 a week. So we're going to see a lot more COVID-19 out there. So don't get alarmed, don't get panicked because the numbers are going to go up. It's just that now we're able to document it. So I just want to let the community know everybody's anxiety level is high, and you'll see the numbers rise. That doesn't mean that the disease is now rampant. It's probably here among us a lot more than we realized. We just haven't had the capability to document that.
Thank you all, and thank you all for watching. I want to especially thank the Jefferson Educational Society for partnering with LECOM. I want to thank Rich from the County Health Department for coming out of retirement to help us through this. And I want to help all of our LECOM physicians who are very busy with this, Dr. Murillo, Dr. Hansen, and Dr. Lin. And one final thought, I said this yesterday at the county executives meeting. Every generation before us has faced tremendous challenges relative to the common good. World War I, World War II, people had to give things up, they had to sacrifice for the common good. This is our time, I think, in a sense, to step up to the plate because we have to sacrifice for the common good. As Dr. Lin mentioned, we have to make decisions that are good for all, to take things away from ourselves in terms of where we might go, where we might travel, to social distance, to use common sense in order that we can improve the common good. That's the challenge to this generation as we face this virus, and I think we're well on our way to doing that. And on behalf of the Jefferson Educational Society, Rich, and our physicians from LECOM, we thank you kindly for watching, and good night.